This conference will now be recorded.
Good morning. Thanks for joining us today. It's May 11th, 2021. I'm Melissa Morin, public health information. Nope, not a public health information officer, just a public information officer with the Whatcom County Health Department. Just a few reminders as we get started. We will be opening things up for questions after we've heard from our two speakers today. Feel free at any time throughout this to type your name and media affiliation into the chat, and we will call on folks in the order that they present. We are recording this, and we'll make the recording available later today, whatcomcounty.us/COVID. Check out our media page for that. And with that, I'm going to turn things over to Erica Lautenbach. We have Erica, our director, with us today, and Dr. Sudhakar Kalapudi from Peace Health here to share some remarks with you, and then we'll take questions once they've concluded. So take it away, Erica.
Thanks, Melissa. I want to give you a brief overview of where we're sitting in terms of case rates, readiness for the roadmap to recovery reevaluation a week from today, as well as vaccine and what we're seeing.
Brandy, talk a little bit about how we could see this rift in the GOP play out in our.
Thanks for muting, appreciate it. So in terms of our case rate and hospitalizations, and Dr. Kalapudi will talk more about the experience at Peace Health and what they're seeing in terms of hospitalizations, but I can give you sort of the overall rates of where we're sitting. As you all know, we are teetering on the edge of moving back to phase 2 in Whatcom County, pending the reevaluation next week and further data, as well as whether or not there will be a continued pause or a changing of the metrics. We don't know what to expect, but we do know that at this point, if the reevaluation occurred today, we would be moving backward to phase 2. Our overall rates in Whatcom County are 213 per 100,000 over the last 14 days, which is higher than the threshold of 200 per 100,000. And our hospitalizations are at 7.9 per 100,000 in the last 7 days, which is over the 5 per 100,000 threshold. And we are concerned about that. We are concerned about the high rates of hospitalization. And what we're also seeing is we have not, like some of the counties in our region, we have not seen a leveling off or a reduction in our cases. We continue to see high rates of cases, about 37 on average per day, which is over what sort of the crude estimate of about 32 per day to be under that 200 per 100,000 number. So that's concerning. I want to share a little bit of information about vaccination rates. Some good news. We are now, last week we reached the milestone of initiating vaccine for over 100,000 of our residents. As of, I believe, yesterday, we now have 107,130 residents who've initiated vaccine, which is wonderful. That's more than half of who will be eligible, even as we bring in that 12 to 15-year-olds in the near future. We also have 81,411 people in Whatcom County who are fully vaccinated, which is a great indicator, and that's about 35% of our population, good indicator of our community immunity. So making progress. As we've talked about in the last couple of weeks, we have seen a pretty significant slowing in demand for vaccine. Many of our providers are shifting their practices. The community vaccination clinic that we partner with a number of different organizations at BTC is now accepting drop-ins and walk-ins, no appointment needed. Other providers are partnering to have mobile and pop-up clinics, really trying to meet people where they are and remove any barriers that could exist for them to not be vaccinated. But our overall message to our community is the right time to be vaccinated is now. Please get your vaccine. There are appointments available everywhere, and there's opportunities to walk in. We are also partnering with Unity Care Northwest today to provide a clinic for our unsheltered population in Bellingham and Whatcom County. And we are partnering with a number of organizations, including Hoagland's, tomorrow to reach East County residents in the Kendall area. So there are lots of examples of good community collaboration where we're trying to reach folks in their own communities and neighborhoods rather than asking them to come to a fixed site. As we know, the model needs to shift as the demands and the needs shift. I want to talk a little bit about, so I mentioned that 213 per 100,000 rate, and I think it's really important to note that now we're at a point where that is really our indicator of those who are unvaccinated. Among those who are vaccinated, which is now nearly over a third of the population, we see about 1 to 2 cases per 100,000. So when we actually look at that 213 of the overall population, it's really much, much higher than that among those that are unvaccinated. And we are also seeing really dramatic differences in not only those breakthrough cases, but also in terms of hospitalizations among vaccinated versus unvaccinated. And we're seeing locally, not just statewide or nationally, we're seeing locally that based on the data that we have, that the vaccines are 95% effective in preventing infection following a vaccine. So it's remarkable. It's more than we had hoped for. It is consistent with what the FDA approved in these rates, and it's a really strong testament to the value and the utility of these vaccines in our hopes to return to normalcy, to reopen businesses that are still closed or at low capacity, and to be able to move forward from this pandemic. I want to share a couple of sort of striking statistics that we have found as it relates to hospitalizations, and then I will turn it over to Dr. Carla Pudi, who can talk more and provide some more information about the experience at Peace Health. But regionally, so this includes counties in our overall North region. In the last 6 weeks, the number of new cases among age 18 to 65 has doubled, and the number hospitalized in that age group has tripled. The median age in our region of COVID hospitalizations has decreased from 67 years old in January to 52, a full 15 years in April of 2021. And that's regional data, but certainly is reflected in what we're seeing in Whatcom County as well. So we're seeing lower ages in the hospital, both locally and regionally, and we're seeing more severe cases among those who are infected with COVID. So I want to stop there and give Dr. Carla Pudi some time to talk about his experience at Peace Health.
Thank you, Erica. Thank you for inviting me here. And good morning, everybody. My name is Sudhakar Karlapudi. I serve as the Chief Medical Officer for the Northwest region of Peace Health, and I live in Bellingham, Washington, and my primary office is at St. Joe's. So 3 or 4 weeks ago, there was an 8-hour period in time at St. Joe's where we did not have a single COVID patient. And then after that point in time, within about 10 days, we saw a high of 28 patients with COVID. And today we have 19 COVID patients in-house. A few things about how this disease has changed. During the first, second, and third waves of the pandemic, most of the patients who required significant healthcare support, being in the ICU or in the hospital, were predominantly in the age groups of the above 60-year-old, 70, 80, 90. That's the age group that we saw in the first 3 waves. This fourth wave we have seen the age bracket has definitely shifted. We are seeing 40-year-olds, 50-year-olds, and early 60-year-olds getting admitted. Another key important difference is patients are seriously sick requiring ICU level care. A large number of those admitted are actually requiring ventilator support and high flow oxygen support. We have also seen patients as young as those in their early 20s requiring to be hospitalized because of this disease. So it's definitely changed. It's no longer a disease that has serious effects only on the elderly, but also in the young. So as of today, we have 19 patients in the hospital, of which 5 are in our ICU and the remainder are in our MCU units. We currently have capacity to care for additional COVID patients should any of our community members develop COVID and need us. So we have that ability. So that's the COVID update, and that's the change that we have seen in the disease characteristics. One thing to note is since the fourth wave started, we have kept a close tab on trying to understand the patient's risk factors for getting COVID. And as part of our workup, our physicians do ask patients to understand the patient's vaccination status. And I can tell you with confidence that so far, all patients who have been admitted to St. Joe's with COVID had not received their COVID vaccine yet. Essentially, what that tells us is it proves what science is proven to us before, that the COVID vaccine essentially prevents people from getting the severe form of the disease. And I think we are seeing that manifest in Whatcom County based on our experience with the fourth wave and the vaccination status of our patients who are admitted with COVID. Lastly, and second thing, I wanted to talk a little bit about the vaccine. I do hear that we have seen a significant decrease in the demand for our vaccine. Last week, Peace Health was scheduled to give 1,750 doses, and we in the past have given much more doses than that. So we've seen a decrease. As Erica said, the Health Education Center site at St. Joe in Bellingham is open to walk-ins, and we are accepting, and we are looking forward to additional work that's going to happen with the American College of Infection and Immunization Practices that's going to deliberate on FDA's decision to approve the Pfizer vaccine for children above the age of 12. So we are eagerly looking forward to that decision, and we'll ramp up our process based on what we see from ACIP. A few things about vaccine hesitancy. Questions come up about vaccine safety. Based on most recent data from CDC, more than 245 million doses of COVID vaccine have been given. And last doses tell us that risk of anaphylaxis is about 2.5% with Pfizer and about 2.5% with Moderna, sorry, and 4.8% with Pfizer, which are very, very per million, sorry. So they are very safe vaccines. And they're very, very effective in preventing disease and severe disease for sure. They do have side effects, and they are transient, temporary, and do not result in anything that is like the COVID disease itself. So definitely from a risk benefit perspective, I would strongly recommend vaccination to anybody who does not have any contraindication for vaccine. And I say that with a certain sense of urgency because as it's increasingly becoming likely that we will, as a country or maybe community, not reach herd immunity because we have not vaccinated. While we have achieved, I think 100,000 is what I heard Erica say, and that's about 35% of our population. We still have a large number that's not vaccinated. So I say that with a little bit of urgency to encourage everyone who can get the vaccine to get a vaccine. They're essentially nothing short of a miracle of modern medicine to have such a safe and effective vaccine. And finally, I wanted to just acknowledge that we have been living in an altered world since February 2020. In the last 15-16 months, our lives have changed, and we have carried a certain fatigue with the way our life has changed. And I just wanted to remind everybody that that we have to carry this fatigue a little bit longer. While encouraging our community members to get vaccinated, we have to maintain social distancing, and we have to follow CDC guidelines on masking, and we have to wash our hands. That's a responsibility that we have to carry this with us, because if we do it, it has shown, and it will continue to save lives. We have been very successful as a community to follow these, and we have saved lives. We just have to do this a little longer while we get the rest of our county members vaccinated with what we have available. So I'll stop there and give it back to you, Erica or Melissa.
Thanks, Dr. Karlapudi. We will go ahead and open things up for questions here. So members of the media, feel free to type your name and affiliation into the chat box, and we will call on folks in the order presented. And Eric, I think maybe we're going to add just a couple there. Great.
So behind the scenes, our data team pulled, I shared that our overall rate in Whatcom County is 213 per 100,000, but among those who are unvaccinated, that translates to 289 per 100,000, and it nearly 0 per 100,000 in terms of our vaccinated population. And likewise, while our overall hospital rate is 7.9 per 100,000, which is over that 5 per 100,000 that the state requires for the metrics, among our unvaccinated population, that is 19.3, so 4 times the threshold that the state has set for us. And among those who are vaccinated, it is 0 per 100,000. I'll stop there.
Great. Thanks for adding that information. Our first question is from David Rossbach with the Bellingham Herald. David, go ahead.
Hi, Erica and Dr. Karlapudi. Thank you for your time. Erica, beyond the vaccination, is there anything else that is tied to that you're seeing as cause for the increased cases? You know, social gatherings, work, anything like that? I know you guys track that. Is there anything that has popped up as additional to not being vaccinated?
Yeah, thanks for that. We see the trends that we've seen for many months: continued social gatherings, events outside of work. There are continue to be a lot of workplaces that are impacted, but primarily the source of that infection and the continued spread of that infection is outside the workplace. But I think we're working with somewhere between 75 and 80 businesses that are currently impacted by COVID cases. And we do see statewide, you know, we're a small county, but we're not terribly unique from counties in our region or our state. And there is evidence statewide that the variants that are more and more prevalent in our communities are more transmissible and do cause more severe illness, as Dr. Karlapudi shared in what they're seeing locally. But that's based on what we're seeing statewide.
Thanks. Our next question is from Robert Mittendorf with the Bellingham Herald. Robert, go ahead.
Hi, thanks, Erica and everyone. Erica, what you told us today is pretty much what you briefed the Bellingham City Council with yesterday. And I'm not sure if you stayed to listen to the entire meeting, but during the public comment of that meeting, there were several speakers who discussed information that I could only describe as fantastic in the true sense of the word, as being fantasy or whole cloth. How are you going to combat this information? Because that seems to be what's holding us back in a large part.
I'm going to invite Melissa to join me in this response. We're having a lot of conversation about how we combat some of, this is some of these myths, rumors, theories are nationally based, that are much bigger than Whatcom County, that have wide variety of people who subscribe to the myths, rumors, and theories. But locally, we do our best via all of the various sources, talking with all of you, giving you the opportunity to myth bust with us, using social media as a platform, using public meetings as a platform. And maybe Melissa, you could speak more specifically as you lead our communications team about the ways that we're trying to address this.
Yeah, I can certainly add a bit more to what Erica said. I will say that the challenges that we face are far larger than just Whatcom County, which I know that all of you listening here know this. When we think about the ways that some of this misinformation is shared, it's happening through media and social media, which unfortunately, as much as I would like to be able to talk with Facebook, they don't want to talk with me about some of the challenges that we're experiencing. So we know that we're not going to be able to go up against the ways that some of this misinformation is shared. But what we're really seeing and are working on is identifying folks from our community who are, making decisions based on the science, making decisions on the best available information, and encouraging folks to really share that out through their networks. So looking for folks who are trusted and known faces in our community who are following the science and can share about their experience getting vaccinated. And, also really our healthcare professionals, this is what they do. They understand how vaccines do and don't work. And certainly asking a lot of our healthcare community, as Dr. Karlapudi and others have done, to really step up and share that information as well. We certainly also absolutely encourage people to have these conversations with their healthcare providers. That's what we do for all of the decisions we make with healthcare, and this should be no different. So really encourage folks to do that. It's natural and normal to have questions. This is new, that information has been changing so quickly over the past year. So it's natural and normal, but in terms of getting good answers to those questions and relying on fact-based information, those are really the two sources that we encourage people to turn to, and ourselves are looking to partner with in order to get that solid and fact-based information out there. We know that for some folks, we as the public health department, we may not be the best messenger in all cases. So it's certainly partnering with a lot of other folks as well. I'm going to leave it at that, Robert. And if you have follow-up questions, feel free to add those in.
Yes, thank you. I just, the three of you that are illuminated, could you raise your hand if you were vaccinated so we all can see? Okay, thank you.
All right.
I was not only vaccinated, but there were some tears shed of joy. So I was enthusiastically vaccinated.
Oh gosh, yeah, I definitely cried my way through the community vaccination center at ETC as well.
Thanks, I appreciate it.
Yeah, absolutely. Our next question is from Key Aurelia with the Bellingham Herald. Key, go ahead. Key, I see your mic on, but I'm not hearing sound. This is a common problem for us with GoToMeeting. The best way that I found to fix it is actually to leave the meeting and come back, but I don't want to ask you to do that. So if you want to type your question into the chat, I will read that out. In the meantime, I'm going to move on to Tom Bonsi with Northwest Public Radio. Tom, go ahead.
Hi, thanks everyone for making time for us. A question for Erica. With demand for the vaccine declining in the North region, I'm wondering how supportive or maybe skeptical you are about proposals to share surplus vaccines with our neighbors in Canada, who are more desperate, I guess, right now than we are. I noticed the fire chief in Point Roberts has a proposal to have cross-border vaccination clinic.
Yeah, so as a public health agency, the Whatcom County Health Department is certainly interested in getting as many shots in arms as possible to end the pandemic. We are also charged with doing so in compliance with all state and federal guidance and ensuring that county residents continue to have access to vaccine. There are over 2 million people living in Lower Mainland British Columbia, and Whatcom County is not in a position to be a primary vaccination option for Canadians. We don't have jurisdiction over the border. We would just continue to refer you to the Department of Health, as we do have to follow state guidelines around the distribution of vaccine, who can answer questions about availability. And I will share, we've heard anecdotes about Canadians calling in search of COVID vaccines, but we aren't aware of specific instances of people crossing the border to seek walk-in appointments. However, there are some American citizens living in Canada who've sought vaccination in Whatcom County.
And in the case of those American citizens, that's okay if they're okay. And just a follow-up for Dr. Carla Pudi. Do you have any instances where Canadians showed up at St. Joe, or maybe truckers who are allowed to go back and forth? And we're hoping to get their shot sooner here.
Oh, Dr. Keb, I think we've got you muted still. Dr. K, we've still got you muted. I just want to double check that things are working okay on the audio there.
Can you hear me?
Yeah, there we go. Thanks so much.
Sorry, I've said it twice, so I must have practice. Tom, I have not heard of any person coming, from Canada or on their way to Canada, stopping at St. Joe's to see if they would qualify for a vaccination. That has not happened, to my knowledge.
Thank you.
And also, so far till last week, our vaccinations were all by appointment. So I don't know if we didn't have a walk-in. So we'll have to just watch and see if that's a demand that increases now as we make it walk-ins more available.
All right, thank you. I'm gonna jump down here to the question from Key with the Herald. Key's question is for you, Dr. Carla Pudi. Can you tell me about the incident command structure that Peace Health has set up because of high patient capacity? What does that entail, and how many people can be helped?
Thank you, Key. On a different note, Key, we set up incident command for COVID since March, and we have had it active in some way, shape, or form since. So we have had an incident command structure that's very common in hospitals. It's called the HIC structure, hospital incident command structures that we use. The hospital has been very, very busy. Being the only hospital in our county and for the region, it's not unusual for St. Joe's to be at, at very high capacity normally. And for the last week, we have seen a significant increase in patients coming to our ED. We have not seen an increase in COVID patients beyond the numbers I just told you, but our numbers have increased, and we've now elevated our existing incident command structure into a incident command capacity management structure. And what that allows us to do is bring in all the resources that we as a hospital need in order to continue to provide services for our community. So essentially the aim is, the primary aim of the incident command structure is to continue to provide care to all members of Whatcom County and those who come to our ED. So that's what we have in place right now.
Great. Thanks, Dr. K. I know that, Dr. K, you do need to get back to a conference, so I want to just offer one last chance for any questions from our media partners here today. Otherwise, we will need to wrap things up here in just the next few minutes to get get our speakers onto some other meetings.
Can I say something?
Yes, please do.
So I wanted to go back to that first question and comment on myth busting. So I didn't listen to the town hall meeting recording, so I really do not understand the full scope of how our community is expressing their fear or concerns around vaccine. What I wanted this group of people who have access to the hearts and minds of people is that we at St. Joe's want to partner with you to get the right message across. So we really need your help. We are experts in science. We are not experts in media and communication. So please know that if you need help from St. Joe's, Bev Mayhew is the best person to get. We are happy to have experts in the field of infectious disease, ICU, myself, be present and partner with you in communicating the importance of getting vaccinations. It's in my mind, if you have a fever and you want to reduce a fever, you take a Tylenol. It's as simple as that. This is a highly effective vaccine, and it prevents severe form of disease. It prevents heartbreak. It helps people live normal, fulfilling lives. So I would do anything to help get the message across.
I'll second that. Thank you all for everything you are doing to share accurate information and articles around vaccine. We really do appreciate it.
Thank you.
All right, thanks everyone for being here today. We appreciate your time. And again, we will make this recording available on our website later today. Have an excellent day. Thanks so much for joining us.
Thank you, everybody.